Today I'm going to talk to you about cracked teeth. What causes a tooth to break or fracture? Usually somehow the tooth has been weakened. Most commonly it's been weakened through a filling or basically a cavity at the beginning. Tooth has a cavity, it eats away some of the tooth structure, weakens the tooth. We come along, as dentists, we put a filling in there to fix the hole. Now it does fix the hole, it does help to repair some of the tooth that's been lost, but it never really fully repairs all the structural integrity that's been lost with the tooth. If it's a small filling, it's not a problem. The tooth is still quite strong, but if it's a large filling, especially if it's a filling that runs right through the tooth from one side to the other, then you get two sides of the tooth that are now separate and they become weaker. And they won't break right away, but after 10, 15, 20 years, sometimes these teeth will start to break. When we chew, it's not strictly an up and down vertical motion. We kind of mill our teeth, and so the sides will flex a little bit. If this filling that is in the tooth is fairly small, then there's still a lot of thickness of the tooth and a lot of strength and structural integrity. But if the filling is quite wide, because the cavity was quite wide, the thinness of the tooth means it'll become weak, and over time it starts to flex and it can break. The type of filling is also important. Most people don't realize, but a lot of people still have these silver fillings, metal fillings, mercury fillings, amalgams, all by the same material by different names. These expand and contract with hot and cold whenever we eat and drink. The expansion coefficient of this filling material is about 30 to 35. The expansion coefficient of enamel and dentin is 9 and 11 respectively. What that means is when we drink something hot or cold and we've got these mercury fillings in our mouth, it expands and contracts 3 times greater than the surrounding tooth structure. So if you've got a small filling, it's not a problem. There's lots of tooth structure to withstand that little bit of expansion. If you've got a very wide filling, you get a lot more expansion on a volume basis, and secondly, you've got much less tooth enamel to resist that, and over time they start to flex over many years and then eventually breaks. So unfortunately, these teeth with large fillings are prone to break. We overcome that, or we try to overcome that by, if we see a tooth that's developing cracks or has large fillings, by placing caps and crowns on it, but that gets into a different story. Other things that can weaken a tooth are root canals. Sometimes, unfortunately, the cavities are so deep, we have to do a root canal if you want to save it. And that's several more blogs to talk about root canals, but I'll just leave that issue for now. But root canals do take away some tooth structure. Over time, it's thought and believed that root canal teeth do dry out, they become a little desiccated, and that also weakens a tooth. So a root canal tooth is actually more prone to break. Hence, that's why as dentists we talk about crowning these teeth. Other things that happen is that can cause teeth to fracture is clenching and grinding. A lot of people clench their teeth and grind their teeth, and they don't think anything of it. Clenching and grinding can cause a tooth to fracture. I've even seen a patient fracture a tooth in half through clenching. This was a tooth that didn't even have a filling or a cavity on it. It was an upper molar, and he came in with a terrible toothache. I couldn't figure out why he had this toothache until I looked at it closely. He had actually fractured it in half because he was clenching and grinding so hard. When we bite into hard foods, we bite with a pressure of about 200 to 300 pounds per square inch, but when we clench with 500 to well over 1,000 pounds per square inch. And secondly, when we bite into hard foods, we make contact for a split second and then release, but when we clench, the pressure is sustained. So clenching and grinding can be a big factor. Other types of trauma, of course, falling down, biting into something like a hard rock or something that you weren't expecting will cause a tooth to fracture. But unfortunately, usually what causes teeth to fracture is things that have occurred to our teeth when we're young. When our teens or early 20s, we've got these cavities, got these large fillings. Now 10, 15, 20 years goes by, we're into our 40s, 50s, and 60s, and if they haven't been repaired properly and strengthened as best they can, they will fracture.